There are few resources to properly fight diabetes in the Valley. That's according to nurse practitioner Yvette Ortega with Cameron County Public Health. It boils down to cost. Patients will go undiagnosed because of expensive lab work or treatment. Finding the right doctor can also be a challenge if you can't pay travel expenses. But we learned you could see a doctor in Houston for free without leaving South Texas. Channel 5's Christine Galvan takes a closer look.
It's not much of a building, but inside,
if we can just get people to realize, yes, grandma had diabetes, mom had diabetes, dad had, but I don't have to get diabetes.
Sister Margaret Palmer
came to the Valley about 5 years ago, and I'm a nurse.
And the rest of the staff for Proyecto Juan Diego work to help people identify their risk for developing diabetes, a disease that can lead to
heart disease, dialysis, amputations, vision problems, all the things that go with uncontrolled, untreated diabetes.
The latest numbers from the CDC indicate more than 30 million people in the United States have diabetes. In the Valley,
but it's 1 in 3 adults is diabetic here, and 2 of those 3 don't know they have it.
41-year-old Abraham Medrano knows he's diabetic. He found out.
I would say my early 20s.
Was that a shock?
Yeah, yes it was.
Medrano is now enrolled in Proyecto Juan Diego's free diabetes program, Salud y Vida, which emphasizes
diet, exercise, how they deal with stress, rest and prevention, being aware of what's needed, checking their eyes.
Back in the day, it's just like eating and eating and eating, but now it's like, ooh, you know, I got a handful. But my hand's pretty big, but I gotta like bring it down a little bit.
Staffers use visual aids to guide the process. Take a look at the middle tube. It's labeled maximum daily sugar, 40 grams, 160 calories. The other tubes show how much sugar is in a small hot fudge sundae, a 20-ounce soda, 2-ounce Snickers bar, and a 20-ounce sports drink. Similar tubes convey fat intake, 3 large slices of pizza, large French fries, a classic sweet roll, and a large cheeseburger.
We may provide the information, the teaching, the interaction.
Do you cook the quinoa?
Yes, I
do.
do.
You like it?
It was actually good. Yo le puse fresh basil.
It's in cooperation with the neighbors, with others in the area.
Sister Margaret says UTRGV sends its mobile medical van twice a month. They also partner with UT Houston Public Health
to provide telemedicine, which is a new thing, so that people who have no health insurance, don't have a way to get to a doctor, can still be seen, literally seen by a doctor and interact with them. And it's amazing. The visit with the doctors are free, both here and in the van.
So the program that I'm in at the Rio Grande State Center, my meds are like very cheap.
That's also where he learned about this place.
I do get a monthly income from my SSI, but it isn't enough to cover expenses. I have applied for Medicaid, but I don't qualify because I make too much.
Right.
Yeah, and that's a difficult thing.
He's not alone. The need for services is so great, Proyecto Juan Diego will soon move out of this old building.
It's a blessing that they're here.
Where so many lives have been changed and saved. Christine Galvan, Channel 5 News.